Health correspondent Nicola Hill joins us from London. Good to see you, Nicola. Tell us, how is this impacting the mental health of nurses? Because, you know, what we've seen and what we're hearing is just so traumatic.
It is indeed, isn't it? And we've seen quite a lot of both doctors and nurses posting on social media, on Facebook, on Twitter, showing their absolute exhaustion, their fear, and the fact that many of them are feeling completely stressed with what they're having to deal with on a day-to-day situation. We've seen pictures of doctors in Italy crying, and we've had nurses in the UK putting on Twitter as they sit in their cars on their way home just in absolute tears. And also because of the actual physicality. You can see these pictures of here. These are the marks on the faces of our healthcare workers who are having to wear these PPE. Obviously, that's saving their lives, but it does have an impact on them. And it's not just anecdotal evidence. There was some research published in the medical journal JAMA interviewing doctors and nurses and healthcare workers from 34 hospitals in China. And the results showed that over 70% of them said they were distressed by what they were having to see and deal with. More than half of them were showing symptoms of depression. 45% said that they were really struggling with anxiety issues. And more than a third of them have insomnia. They're not able to sleep at night. That's because they're constantly haunted by what they're dealing with, what they're seeing, and their fears, whether they're having to make these life and death decisions of who to put on a ventilator, or the fear that they're putting their own families at risk.
It's so awful. It really is. Nicola, have you managed to speak to any nurses or doctors yourself?
Well, actually, Maria, I spoke to a nurse this morning. She'd just done a night shift in a very busy hospital here in the UK. And I felt humbled by the fact that, you know, I'd had a night's sleep after Easter here in the UK. And while I was asleep, she'd spent more than 12 hours dressed in those PPE outfits that we've just seen, with the marks on her face from trying to avoid a pressure sore on her nose. But not only the physical problems, but the mental problems. And I'm going to call her Brenda because of she wants to retain her anonymity. And she was telling me that she's haunted. She's haunted by the fact that she can't do her job properly. As a nurse in intensive care unit, she's normally not only monitoring the blood gas and all the physical issues that you have to deal with the patient, but she's normally caring for their relatives. And the fact that she can't do that, the fact that she actually can't cuddle a relative who sits by their by a sick patient, the fact that she actually has to just make a phone call to let them know that they've gone is really haunting her. She says she has an overwhelming sense of doom the whole time. She too is one of those who's not sleeping. She says she wakes up with nightmares and has to check that her husband's still breathing. She's also worried about the junior staff that she's working with. Now, normally they will work a certain number of hours and a certain number of shifts, but Brenda's doing many more hours, working many more days, and like many of the healthcare workers, there's no end in sight. And she's having to deal with 3 times as many patients. And she was keen to tell me that they're not just the elderly, they're not just people with underlying health conditions. 30% of the patients that she's seeing are under the age of 40. 50% of them are under the age of 50. And the fact that it is younger people that she's dealing with as well is having definitely an impact on her mental health and those of her colleagues.
It's very sad indeed, Nicola. And I'm going to ask you a question that it pains me because I've asked it so many times since this pandemic was declared a pandemic. What can be done to help these nurses and doctors? And yet we've heard that the health minister said there's going to be a Herculean task to help them. The Prime Minister gave a beautiful speech in which he thanked the NHS and said he owes his life to them. He even named the nurses. And he said, the NHS, we will survive because it's fueled on love. And yet, you're telling us how much they're suffering. I asked that question again, what can be done to help?
It's a difficult one, isn't it? Brenda told me that she's meditating, that she's set up WhatsApp groups with her team, and they're definitely offloading onto each other. When they can, they are giving each other hugs, they're listening to each other. The WHO says that leadership management teams should set up adequate psychological services for our healthcare workers. But of course, at the moment, they're stressed. It's quite difficult for them to do that. You say what can be done. I mean, this is what needs to be done, isn't it? They need to have proper psychological support. They need to have somebody taking care of their mental health as well as their physical health. But it seems at the moment it's healthcare workers are having to do that between themselves. I don't know. I'm sure there are probably various helplines set up nationally in different countries across the world. But it seems from the people that I've spoken to, they don't have time to ring strangers. What they're actually doing is just speaking to their colleagues. And of course, if they have got family, offloading onto their family. But it's like you said at the beginning of this, many of them have isolated themselves from their own family members because they don't want to risk bringing any disease home to them. So I think one of the things Brenda said to me, they're a very tight team and they are helping each other. And that seems to be, at the moment, it's that emotional support that each health worker is giving their colleagues is what's keeping them going.
Nicola, thank you so much. And well, yeah, we really appreciate this, these details and insight into what the nurses and doctors are going through. Thank you.